pain level, where would you say it's at on a scale of 1 to 10?
6 or 7, maybe.
6 or 7. And does it hurt more to turn to the right? Yeah, okay. What about turning to the left?
Not as much, but it's still there.
Okay. And then does it go down into the shoulder blades at all?
It does, yeah.
Okay. Okay. So today we're going to do a little bit of what I like to call balance method acupuncture. So we're actually not going to do any points in the neck itself. First I'll show you kind of like the pressure points with a little AcuPRESSURE tool, and then we'll go ahead and needle the points to try to get this pain down. So, all right. Yeah, it's feeling pretty locked up in there. Tender there? Yeah, okay. All right, so when we look at the neck, right here, this is the gallbladder channel. And it doesn't necessarily have anything to do with your actual gallbladder. This is just where the gallbladder channel leads up to. And so this is the typical area where people end up with neck and shoulder tension, either from working at a desk all day long or just general stressors of life leading to tension and carrying sort of the weight of the world on our shoulders. And so when we look at balancing this channel, we are going to go to the paired channels for the gallbladder channel, which include the liver channel. The liver and gallbladder are intimately connected, and then also the heart channel and the kidney channel. Those are the 3 main channels that I like to use to balance out neck and shoulder tension, and I'll show you where those points are so that if you're kind of watching at home, you can feel free to do some acupressure on yourself to relieve this pain. And typically what I like to do is, in order to balance this gallbladder channel, I'll go to the opposite side ankle, and we'll show you those points, and that's kind of like the liver and kidney points over there. And then I'll also go to the opposite wrist, which will be the heart channel. So let me grab my AcuPRESSURE tool. Okay, so to treat the right side of the neck, I typically go to the liver channel. And the liver channel starts, at the big toe, and then it kind of goes up and through the medial aspect of the ankle here, and then it kind of goes up like so. And so the neck is reflected in the ankle. So we're gonna kind of feel around for all the typical spots that are tender when we have pain in the neck. And what we're always looking for with acupuncture is the ashi points, or the points that are tender. And so this is just a little AcuPRESSURE tool where we can kind of figure out what are the more sensitive channels for Tom, and then we'll go ahead and needle those at the end here. So first I'm gonna feel around in here. Is that tender? Okay. Is that tender? Okay. Tender? Yes. Okay. Tender? Yes. Okay. So these are sort of like the liver points, and what I like to do with the needle is I like to thread it sort of along the skin this way, and with each one I will check in and see how he's feeling, and then kind of decide whether or not to add some kidney points. Now the kidney meridian, if you can just turn your leg a little bit this way, so the kidney meridian goes along the inner aspect, so it actually starts at the bottom of the foot here, and then it kind of goes up the inner aspect of the ankle here and towards the more back of the calf. And so the kidney channel is also a balancing channel for the gallbladder channel, and the mirrored area is of course the ankle. So we're going to feel around the ankle and above. So when we think about the neck and shoulders, the neck is sort of in the joint, and then the shoulders are sort of in the medial aspect of this calf here. And so we'll feel kidney 3. Is that tender? Not so much. Tender there? Yeah, so that's more like kidney 7-ish. Is that tender there? Yeah, okay. Is that tender there? Okay, so this is more like spleen 6. And tender there? Okay. But if you're at home and you're experiencing some pain in the neck and shoulder area, feel around this liver channel here and the kidney channel here and see which points are most tender. You can just feel with your fingers and kind of start at the ankle joint and then kind of go up a little bit. Now, if you have pain in the shoulder blades, going all the way up to liver 5 would be a good spot for you. So take your hand and make an L with it, and where the end of the hand lands right in the middle of the calf, that's liver 5. And so that is tender on Tom. He's nodding to me. And this is a point that you would do if you have that, in between the shoulder blade pain. Okay. So those are the points on the legs that we'll do, and then we'll show you the points on the wrists that are also very good for neck pain. Okay, so next we're going to feel around the heart channel, and the heart channel is along the pinky side of the wrist and hand, and it goes all the way up to the elbow and into the armpit. And the points, just like on the ankle, that are really, really good for neck and shoulder tension are all along the wrist crease, just like the ankle bone, and then the area above that kind of leads into the shoulders. So let's feel around here, see if there's any ashi points for Tom. Tender there? A little bit, not as much. How about there? Okay. There, okay. So this point is kind of like heart 4 area, and so we'll be needling that one when the time comes. And what about that one? Yeah, okay. Tender there? Okay. All right. So if you're at home and trying to see if you can do something to help your neck pain, then going to the inner aspect of the wrist here and feeling around the heart channel, which is just on the inside of this tendon here, which is the carpi ulnaris. And we just kind of feel in this general vicinity for the hot spots, and when we find one, you press on it, and as you press on it, move your neck around just to bring some blood flow to the area, and you'll notice that depending on which ones are most tender, that it can alleviate the pain almost instantly. So if you're dealing with some tension in your neck, please try it at home, because I have really, really amazing results with it, and I want you to find the relief that you deserve. Okay, so the next area that is a sort of mirror of the neck area is on the abdomen. And so when we palpate the abdomen, we kind of feel around for the xiphoid process, which is right at the meeting point of the rib cage here, so kind of right where this little mole is. And if we are going to find the area of the neck, what we do is we take the distance from the umbilicus to the distance of the xiphoid process, and we meet in the middle. Now this is REN 12 or CB12, and this is sort of reflective of the mouth area. So if we want to go to the neck, we just go a little bit of the way down. And so the neck area is going to be reflected right around here. Is that tender, Tom? Okay. And what about there? Yeah, okay. What about there? Yeah, okay. What about there? Yeah, okay. So all of these points here are tender, and these points are kind of like right around CV11, CV10, CV9 is like right around here. And so we will go ahead and come back to these and needle these once we're done with the legs and the arms. Okay, so we are going to start the needling portion. Okay, so just as a review, the liver 4 area and these sort of like, these aren't actual acupoints, these are just like along that mirrored channel of the liver. So these guys are usually tender on most people who have neck and shoulder pain. So because Tom's pain is on the left side, then we're going to needle the right ankle. Okay, so we'll just swab the area. And then we're gonna check in with Tom. So Tom, I'm gonna have you move your head back and forth, side to side. And what's your pain score right now?
Still around 6, I'd say.
6 or so? Okay. And so then we're gonna do one needle at a time and check in with Tom and see how that tension is doing and see if there's any change from each needle. And what we're looking for is incremental progress, and then also if the pain moves as we're doing this, then that's a good sign. It means we have it on the run. And so we're gonna first needle liver 4, which is right in here, and take a nice deep breath in, Tom, and release. And we'll leave it right there for a moment before we adjust the depth. And then we'll gently guide it in. And we're trying to get sort of a chi sensation here, so okay, and then Tom, I'm going to have you move your neck back and forth.
I feel a little better. More motion.
More motion, more mobility. So a scale of 1 to 10, where would you put it?
I mean, still 4 or 5.
4 or 5? Okay. All right. All right. So we're going to do this point now, and nice deep breath in, and release. And we kind of thread it along sort of this area here, and move your neck around a bit.
It's much better.
Any pain in there?
Yeah, I mean, it's still like the numbness, but it's not as sharp.
Okay.
Like a 2 or a 3. Yeah.
2 or 3. Okay. All right. And then let's see. So is this point tender? Not as much? Okay. How about there?
Mm-hmm.
Yeah. How about there?
More
More so? Okay. So this is kind of like kidney 7. Nice deep breath in and release. Ooh. Got a chi sensation on that one. Did it go down into here? Yeah. That's kind of the channel that it takes. It's like really cool when you get these like almost like electrical sensations from acupuncture needling, because it kind of shows you the exact map of that nerve pathway. So the kidney channel goes, from here down to here and to the bottom of the foot. And typically when we get a chi sensation on that kidney point, that's exactly the channel it takes. It goes along and ends at the bottom of the foot, which is really quite cool. A lot of people sort of come to my channel and make comments like, this is pseudoscience and this is absolute garbage. And, the funny thing is that acupuncture and acupuncture theory is thousands of years older than modern medicine. And yes, modern medicine has the, equipment and the advances to kind of do these more scientific lab style experiments, but I think the ancient Chinese and ancient cultures in general had just so much more connection to their intuitive wisdom, and the ancient Chinese knew, the pathways of the body that affected other areas, and it's a beautiful thing. And I think that if you can just stay open-minded and just allow, yourself to say like, hey, maybe I don't know everything, then I think beautiful things can happen for you if you just stay open. I think my own superpower in this world is my open-mindedness. I've just always been open to anything and everything, because the truth is we don't know so much about this world, and the more open you are, the more open you are to miracles. So okay, so next we are going to do liver 5, which is that point that's sort of like one hand breadth from the ankle bone, the tip of the medial malleolus, to liver 5, which is sort of right in here. And so we'll have you take a nice deep breath in, Tom, and let it on out. Okay. Did you feel a zing on that one? Okay. So then I want you to move your neck around a bit. What's your pain score?
All the sharp pain is gone.
All the sharp pain is gone?
1 to 2.
1 to 2. And where is it located? Is it more towards the upper part of the neck or more towards the trapezius?
It's kind of moved out of the upper part of the neck, and if there's any soreness left, it's more towards the shoulder.
More towards the shoulder? Okay. Okay. So I think these are good here. He's responding well to these so far. So next we'll move to the wrist and the abdomen. Okay, so we got him down to, like, what would you say, a 2, 3?
Actually down to a 1.
Oh, okay.
Much better now.
Down to a 1? Okay.
0.
So we'll just still show you these heart points and do a little needling on the one that was most tender, which I think was right around here, right? That's tender? Okay. So we'll just do one of the heart points, but if you are doing acupressure at home and you have several of these points, like kind of 1, 2, 3, 4, 5, like just millimeters apart from each other on that channel, you can just kind of like dig your whole thumb into that general vicinity. Or if you have ear seeds at home, you can feel free to put 4 ear seeds all right in a row along the heart channel, and it certainly can't hurt. So with acupuncture, the heart channel is often quite tender, and so we're gonna put a point right in that spot here. Nice deep breath in, Tom, and let it on out. Okay. And go ahead and check in with that neck and shoulder. Has it moved at all, or?
Yeah, I mean, I don't really feel pain in my left now, but I also kind of feel like a little bit of a tweak in the right that I didn't really notice.
Oh, okay. So more on the right side, but like the same area?
Mm-hmm.
Okay.
Yeah.
Okay, so for that, we will go ahead and do those abdominal points and see if we can get that to go away too. So we will swab these points. And then again, we're going for the xiphoid process in the middle of the umbilicus, and we're meeting in the middle middle. So this is the mouth area, and so then right below that would be sort of the neck and shoulder area, and then on either side we have the neck and shoulder area. So is that tender, Tom?
Mm-hmm.
Okay, so we'll needle that one first. And it's interesting because with abdominal acupuncture, it's often, the more shallow the needling, the better, unless you are doing some like back of the body pain. So imagine that there's like an upside down turtle with its shell sort of laying on its back. And so the back of the shell, you'd need to go a little bit deeper to get to the back. So if I was doing lower back pain, I would do some points down below the umbilicus, and I would needle at a greater depth. But because this is sort of more, neck and shoulder area, which is the back of the neck, we still don't need to go quite as deep for these guys. So nice deep breath in, Tom, and let it on out. Okay, so that goes in about an inch or so, maybe even half an inch. Okay, and the abdomen is really cool because it is sort of like another microcosm of the body. So the head and shoulders are kind of reflected here, the lower back is reflected down here, the stomach and the internal organs are reflected around the umbilicus, and it's like a really beautiful, gentle area to do acupuncture. It's not as painful to do acupuncture on the abdomen. It's a little more gentle, and it can be super effective if you do just only abdominal acupuncture for a session. So if you're nervous about getting acupuncture, I would try to seek out someone who does abdominal acupuncture as a way to sort of dip your toe in the water, because the gut is like where we all began, right? Like we all started as an umbilicus, and so it's like science today is just learning about the gut-brain connection. And so by treating the abdomen and the gut, we really can affect change throughout the entire body. So we're going to go ahead and needle 3 points around here. So nice deep breath in, Tom, and release. Okay, and because it kind of moved to the right, we're going to do the right side as well. Nice deep breath in and release. Okay. And for good measure, I'm just going to go ahead and do this one above, as that got pretty red. So nice deep breath in and release. Okay. And actually, just because we are here, we are going to do another couple points for the sinuses. So tender there.
Mm-hmm.
Okay. Tender there. Not as much. That one? Okay. Okay. And nice deep breath in and release. Move that neck and shoulder around. Anything left in there?
No, feels good.
Yeah? Nice. Okay. Any other aches and pains that you can feel?
Not neck shoulder wise.
No.
But you going for the sinuses, so.
Yeah. Yeah. Always gotta treat times Okay, so to finish today's treatment, we're actually going to do some gua sha on the neck and shoulders. So we will let these cook for probably 30 minutes, and then we'll come back, we'll pull, and then we'll do some gua sha on the neck and shoulders. Okay, so we'll pull these out. Sit up and we're gonna do some gua sha on the neck and shoulders. All right, so even though we're feeling better, here, move your neck side to side. Still at a 0?
A little tightness in there, but I wouldn't call it painful.
Okay, so greatly improved. So we're gonna do some gua sha to the neck and shoulder area just to see if we can bring up any stagnation in the tissues. So first I'm going to use a little bit of a liniment called Zhengu Shui, and I'm going to spray it into my hand and then kind of rub it all along the sides of the neck and shoulders. And then I'm going to use some massage oil on top of that just so the gua sha tool glides a bit better. And then we'll have you look down a bit. And I'm just going to kind of go along the paraspinous muscles here and into the shoulder a bit. So you do just a very light and gentle kind of rubbing. If you land on a knot or a mass of tissue, then you just spend a little time there and just kind of go up or down. You always kind of want to move the gua sha tool down. And it's very normal to get some redness there. And then Tom has his little lipoma here that we saw during our exam. He's had it checked out. It is not a tumor. Well, it kind of is, but it's a lipoma. It's just a fatty deposit.
It's my friend.
It's his friend. All right. So we're actually getting a little more sha on the right side, which is interesting. And then I'm going to go into the upper back and over the lungs. And I'm going pretty gently here, but he'll probably light up like a Christmas tree because he always does. Good technique for pain relief is to go along either side of the spine to sort of stimulate the C fibers that lie along the spine. For my fibromyalgia patients, I like to do that all the way down the spine for sort of like a full body pain relief technique. If you don't have a gua sha stone at home, you can use a ceramic dish, a ceramic spoon, like you have have at a Chinese restaurant. And use some coconut oil or some olive oil or whatever oil you have laying around that's like a good quality oil. Or whatever you got is fine. And then you can just go up and down along these rhomboids, scapula. Alright, so we got some good sha. That's what we call that, is sha. That'll heal in about 5 days or so. It's what we see that as is sort of like breaking up stagnation so that fresh blood supply can come to the area to promote healing. So it's completely normal to get these red spots. And each time you do it, if you do it consecutively, you'll get less and less red because your circulation will have improved from the therapy. Does that hurt, Tom? Feels good? Yeah? Okay. Yeah, your right is definitely tighter than the left, which is interesting, seeing as you came in with left-sided pain. But, all right. And even if you don't have a helper at home, you can sort of reach around behind your neck a little bit and do either side like you would, you know, brushing your hair. It's a little awkward, but you can do it. And then to end, we'll use this Yunnan Bayao, which is sort of like a stops bleeding. It just cools everything down and helps it to feel good for hopefully a long time after. All right, it's feeling better in there. How do you feel? Much better?